Barbara pays about $38 a month today for her Medicare Part D prescription drug coverage. At first glance, that amount may not seem especially significant. For many retirees, a monthly premium in that range feels manageable, particularly when compared with other major expenses such as housing, groceries, utilities, insurance, transportation, property taxes, and everyday living costs. After all, when people think about retirement expenses, they often focus on the largest bills first: mortgage payments or rent, food costs, electricity, natural gas, water bills, homeowners insurance, car insurance, internet service, cell phone plans, and other recurring obligations that arrive month after month. A Medicare Part D premium of roughly $38 per month can seem relatively small by comparison. In fact, many retirees may barely notice it compared with some of the larger expenses that dominate their monthly budget month or day. But healthcare costs have a way of changing over time. And even expenses that appear modest today can become much more meaningful when viewed over the course of several years. That is especially true during retirement, when many individuals are living on fixed incomes and must carefully balance every dollar coming in against every dollar going out. According to the latest projections from the Medicare Trustees, the average monthly Medicare Part D premium could rise substantially over the coming years if current law remains unchanged. Based on those projections, a premium that is approximately $38 per month today could approach $69 per month by the year 2030. That represents a noticeable increase in a relatively short period of time. In percentage terms, it is a significant jump. And while the exact outcome remains uncertain, the projection serves as an important reminder that healthcare expenses rarely remain static. They evolve, they fluctuate. They respond to economic conditions, healthcare utilization, demographic trends, policy decisions, and countless other factors. For some retirees, that increase may not create a major financial burden. Individuals with substantial retirement savings, pension income, investment income, rental income, or other financial resources may be able to absorb higher healthcare costs without dramatically changing their lifestyle. But for millions of Americans living on fixed incomes, even modest increases can matter. An additional $10 per month may not seem like much, neither may $20 or $30. Yet when multiple expenses rise at the same time, the cumulative effect can become significant, and that cumulative effect is often what creates financial pressure during retirement. Many retirees have already experienced this reality firsthand. Food prices have increased in recent years. Housing costs have risen in many parts of the country. Utility bills fluctuate. Insurance premiums often trend upward over time. Transportation expenses can increase. Property taxes may rise. Home maintenance costs can become more expensive. And healthcare expenses continue to represent one of the largest financial concerns facing older Americans. When viewed in isolation, a higher Medicare Part D premium may not appear alarming, but when combined with other rising costs, it can place additional pressure on a retirement budget that may already be stretched. Imagine a retiree whose grocery bill increases by $40 per month. Then utility costs rise by another $15. Insurance premiums increase by $20. Prescription drug coverage becomes more expensive. Gasoline prices move higher. Property taxes increase. A vehicle repair becomes necessary. Suddenly, what appeared to be a series of small increases becomes a meaningful change in monthly spending. That is often how financial pressure develops during retirement. Not through one dramatic event, but through a gradual accumulation of higher costs across multiple categories. One increase by itself may be manageable. Two increases may still feel reasonable. But when 5, 6, or 7 expenses rise simultaneously, the impact becomes much more noticeable. That is why understanding these projections is important, not because they guarantee what will happen, but because they provide insight into what experts currently expect could happen if existing policies remain in place. And when it comes to retirement planning, information is valuable. The more informed you are today, the better prepared you may be tomorrow. Now, it is important to emphasize something that often gets overlooked when discussing projections. A projection is not a prediction, and it is certainly not a guarantee. The Medicare trustees publish estimates based on current laws, economic assumptions, demographic trends, healthcare spending patterns, enrollment expectations, and a variety of other factors. These estimates help policymakers, researchers, financial professionals, healthcare analysts, and beneficiaries understand potential future challenges. They are designed to provide a roadmap of what could happen under certain assumptions. However, the future is rarely identical to any projection. Congress can pass new legislation. Healthcare markets can change. Economic conditions can improve or deteriorate. Drug pricing policies can evolve. Medical innovation can alter treatment costs. Inflation can move higher or lower than expected. Prescription drug utilization patterns can shift. And Medicare itself can undergo reforms that affect costs for beneficiaries. In other words, there are many variables that could influence what Medicare Part D premiums ultimately look like in 2030 and beyond. That is why retirees should avoid reacting with fear. The purpose of understanding these projections is not to create anxiety. The purpose is to encourage awareness. Awareness allows people to make thoughtful decisions. Awareness creates opportunities to prepare. Awareness encourages proactive planning. And awareness helps retirees avoid being caught off guard by future changes. Consider Barbara's situation. Like many retirees, she relies on a combination of retirement income sources. Perhaps she receives Social Security benefits. Perhaps she has some savings. Maybe she has a pension. Maybe she receives distributions from a retirement account. Perhaps she supplements her income with part-time work. Like millions of Americans, she carefully manages her monthly budget. Every recurring expense matters. Every premium matters. Every healthcare decision matters. Every dollar has a purpose. Barbara may not think about her Medicare Part D premium every day. Most retirees do not. In fact, many beneficiaries enroll in a plan, pay their premium, fill their prescriptions, and move on with their lives. That is understandable. People have families, hobbies, responsibilities, and countless other priorities competing for their attention. But over time, healthcare expenses can become one of the most important factors affecting retirement finances. If Medicare Part D premiums gradually increase over time, Barbara may need to account for those higher costs when planning future spending. That does not necessarily mean making dramatic changes. It may simply mean adjusting expectations. It may mean reviewing healthcare coverage annually. It may mean setting aside additional savings for medical expenses. It may mean paying closer attention to Medicare plan options during open enrollment. It may mean discussing healthcare planning with a financial advisor, trusted family member, or retirement counselor. These are practical steps that many retirees can take, regardless of what future premiums ultimately become. One of the most important lessons in retirement planning is that preparation often reduces stress. Unexpected expenses tend to create anxiety. Expected expenses are generally easier to manage. When retirees understand potential future costs, they can begin incorporating those possibilities into their financial planning process. That does not require predicting the future perfectly. No one can do that. Instead, it involves recognizing trends, evaluating risks, and making informed decisions based on the best information currently available. Think about how people prepare for other aspects of retirement. They estimate future living expenses. They estimate future income. They estimate how long savings may need to last. They estimate inflation. They estimate investment returns. They estimate future tax obligations. Healthcare planning deserves the same level of attention because for many retirees, healthcare represents one of the largest and most unpredictable categories of spending. In fact, numerous retirement studies have shown that healthcare costs remain one of the top concerns among older Americans. Many retirees worry about whether their savings will last. Many worry about inflation. Many worry about long-term care expenses. And many worry about the possibility that healthcare costs could rise faster than expected. These concerns are understandable. Healthcare planning is particularly important because medical expenses often increase with age. Many retirees spend years preparing for retirement by focusing on savings and investments. Those topics are certainly important, but healthcare deserves equal attention. After all, Medicare plays a central role in the financial lives of millions of older Americans. For many beneficiaries, Medicare is one of the most valuable benefits they will ever receive. It helps provide access to healthcare services that would otherwise be extremely expensive. Without Medicare, many retirees would face healthcare costs that could be financially overwhelming. Understanding how Medicare works, what it covers, and how costs may change over time can help retirees make more confident decisions. Medicare Part D is especially relevant because prescription medications are a necessity for many beneficiaries. As people age, prescription drug usage often increases. Managing chronic conditions frequently requires ongoing medication. Blood pressure medications, diabetes treatments, heart medications, cholesterol prescriptions, arthritis treatments, respiratory medications, osteoporosis treatments, cancer therapies, and many other commonly prescribed drugs. As a result, prescription drug coverage becomes an essential component of retirement healthcare planning. Even relatively small changes in premiums, deductibles, co-payments, or out-of-pocket costs can affect household budgets. A retiree taking multiple medications may be particularly sensitive to changes in prescription drug costs. For someone managing several chronic conditions, prescription expenses may represent a significant portion of monthly healthcare spending. That is why staying informed about Medicare developments remains so important. Fortunately, retirees are not powerless. There are several practical actions beneficiaries can consider as they monitor future Medicare changes. First, review your Medicare coverage every year. Many people enroll in a plan and then rarely revisit their options. That is understandable. Once coverage is established, it is easy to assume that everything will remain the same. However, plans can change annually. Premiums can change. Drug formularies can change. Provider networks can change. Coverage rules can change. Deductibles can change. Co-payment structures can change. Preferred pharmacies can change. Mail order options can change. Taking time to review available options during Medicare. Open enrollment may help ensure that your plan continues to meet your needs. Even a brief annual review can sometimes uncover opportunities to reduce costs or improve coverage. Second, verify that your prescriptions remain covered under your chosen plan. A medication that is covered 1 year may be handled differently in future years. Coverage tiers can change. Prior authorization requirements can change. Preferred pharmacy arrangements can change. Quantity limits can change. Step therapy requirements can change. Understanding those details can help avoid unexpected costs and unpleasant surprises. Third, explore whether you qualify for assistance programs, Some beneficiaries may be eligible for programs that help reduce prescription drug expenses. Programs such as Extra Help can provide meaningful assistance for qualifying individuals. State pharmaceutical assistance programs may also be available in certain areas. Many retirees are unaware that they may qualify for benefits that could lower their health care costs. Yeah. Taking time to investigate available resources may be worthwhile. Fourth, maintain an emergency health care fund whenever possible. Even modest savings dedicated to medical expenses can provide valuable flexibility when unexpected costs arise. No one can predict every health care expense. Unexpected prescriptions, dental procedures, vision care, medical equipment, specialist visits, hearing aids, emergency room visits, physical therapy, home health care needs. These expenses can emerge with little warning. Having dedicated savings available can help reduce financial stress. Fifth, continue educating yourself about Medicare and retirement benefits. Knowledge remains one of the most effective tools available to retirees. The more you understand about your benefits, the better positioned you may be to make informed decisions. Many costly mistakes occur simply because people are unaware of available options. Education can help prevent those mistakes. Another important point to remember is that Medicare is only one piece of the retirement puzzle. Many retirees depend heavily on Social Security benefits. Others rely on pensions, personal savings, retirement accounts, annuities, investment portfolios, rental income, or part-time employment. Each income source plays a role in supporting financial security. When evaluating future healthcare costs, it is helpful to consider how those costs fit within your broader retirement plan. For example, if healthcare expenses rise faster than expected, how might that affect discretionary spending? Would travel plans need adjustment? Would entertainment expenses change? Would dining out become less frequent? Would additional withdrawals from savings become necessary? Would a retiree choose to delay certain purchases? Would gifting plans change? Would charitable contributions be affected? These are not questions designed to create concern. Rather, they are examples of the types of planning considerations that can help retirees remain financially resilient. The reality is that retirement planning is an ongoing process. It does not end on the day you stop working. In many ways, retirement planning continues throughout retirement itself. Financial conditions change. Government programs evolve. Healthcare costs fluctuate. Economic circumstances shift. Family situations change. Personal health needs change. Successful retirement planning often involves adapting to those changes over time. That is one reason why staying informed remains so valuable. Information empowers better decisions, and better decisions can contribute to greater confidence and peace of mind. Many retirees find that uncertainty is often more stressful than the actual expense itself. When people understand what may be coming, they can prepare. Preparation creates confidence. Confidence reduces anxiety. That is one reason why discussions about Medicare projections matter. Not because they provide certainty, but because they provide visibility. They help retirees understand potential future scenarios. And understanding potential scenarios allows people to plan more effectively. It is also worth remembering that Medicare Part D premiums represent only one component of prescription drug costs. Beneficiaries may also encounter deductibles, co-payments, insurance, coverage restrictions, pharmacy pricing differences, and other out-of-pocket expenses. That means retirees should evaluate their total prescription drug spending rather than focusing exclusively on premiums. A plan with a lower premium is not always the least expensive option overall. Likewise, a plan with a higher premium may sometimes provide better value depending on an individual's medication needs. This is why annual plan reviews can be so important. The goal is not simply to find the cheapest premium. The goal is to find the coverage that best aligns with your healthcare needs and financial situation. As we look ahead toward the coming years, there will undoubtedly be continued discussions about Medicare funding, healthcare costs, prescription drug pricing, and retirement security. Policymakers will debate potential reforms. Experts will publish new analyses. Additional projections will emerge. Healthcare economists will evaluate trends. Advocacy groups will offer recommendations. Government agencies will release updated reports. Industry stakeholders will present competing viewpoints. Some assumptions may prove accurate. Others may not. That is simply the nature of long-term forecasting. What matters most for retirees is maintaining awareness without becoming overwhelmed. Understanding potential future challenges does not require fear. It requires attention. It requires curiosity, and it requires a willingness to stay engaged with the programs that play such an important role in retirement. Returning to Barbara's example, the projected increase from approximately $38 per month to nearly $69 per month by 2030 serves as a useful reminder. Costs can change, programs can evolve, and retirement planning must evolve as well. For some retirees, that projected increase may ultimately be smaller than expected. For others, it could be larger. No one knows with certainty what the future will bring, but preparing for possibilities is often wiser than ignoring them. That is why projections matter. Not because they tell us exactly what will happen, but because they encourage us to think ahead. They encourage us to ask questions. They encourage us to evaluate our financial plans. They encourage us to review our healthcare coverage. They encourage us to remain informed participants in our own retirement journey. The good news is that beneficiaries still have time. Time to learn, time to plan, time to review their coverage, time to evaluate their budgets, time to discuss options with trusted advisors, time to build additional savings if possible, and time to make adjustments if necessary. There is no need for panic. There is no need for alarm. But there is value in paying attention. There is value in understanding how Medicare works. There is value in reviewing annual notices from your plan. There is value in comparing coverage options. There is value in asking questions. There is value in seeking professional guidance when appropriate. And there is value in staying informed about changes that could affect your retirement finances. Healthcare costs will continue to be an important part of retirement planning for years to come. Understanding Medicare, Social Security, prescription drug coverage, and other retirement benefits can help individuals navigate those challenges with greater confidence. Retirement planning is not just about accumulating savings. It is not just about investment returns. And it is not just about reaching a specific retirement age. It is also about managing expenses. It is about protecting purchasing power. It is about adapting to changing circumstances. It is about preparing for uncertainty, and it is about understanding the programs and benefits that may support you throughout retirement. For many Americans, Medicare and Social Security form the foundation of retirement security. These programs provide critical support for millions of households. The better you understand those programs, the better equipped you may be to make informed decisions about your future. 1. No one can eliminate uncertainty. No one can predict exactly what healthcare costs will look like 5 or 10 years from now. No one can guarantee what future legislation may bring, but every retiree can take steps to become more informed. Every retiree can review their coverage. Every retiree can evaluate their budget. Every retiree can prepare for a range of possible outcomes. Every retiree can remain engaged with the decisions that affect their financial well-being. And that preparation can make a meaningful difference. The projected increase in Medicare Part D premiums is not a reason to panic. It is a reason to pay attention. It is a reminder that healthcare costs deserve a place in every retirement conversation. It is a reminder that planning is an ongoing process. It is a reminder that small expenses can become larger expenses over time. It is a reminder that awareness creates opportunities. And it is a reminder that informed retirees are often better positioned to navigate whatever changes may come. Barbara pays about $38 a month today. The Medicare Trustees project that figure could approach $69 a month by 2030 if current law remains unchanged. Whether that exact number ultimately becomes reality remains to be seen, but the broader lesson remains clear. Healthcare costs matter, preparation matters, awareness matters, and informed decision-making matters. The more informed you are today, the better prepared you may be for whatever tomorrow brings. I'm Michael Bennett. This is Retirement Watch, helping seniors understand their benefits. Thank you for watching, and I'll see you in the next video.